California Governor Gavin Newsom has recently signed a bill into law that looks to punish doctors who spread misinformation about COVID-19 to their patients, setting up a dangerous and possibly unconstitutional precedent while doing so.
Here to discuss the author of The Courage to Face COVID-19, Dr. Peter McCullough. All right, doctor, let's break this down, because my concern over this is doctors are now disincentivized from having a dissenting opinion. Now, historically, some of the greatest innovations in history, including figuring out the earth is no longer flat, have come from dissenting opinions. How dangerous is this to the medical community?
I think it's extraordinarily dangerous to the community and to civil liberties at large. You know, the word misinformation has been around since the 1500s. It's been used heavily during propaganda campaigns in history. And then in 2018, before COVID-19, the New York Post had misinformation as word of the year because of its use in partisan politics and social media. Misinformation doesn't exist in medical textbooks. It doesn't have any role in medicine. And as you correctly pointed out, there simply are data and scientific observations and a multitude of interpretations or opinions. When patients see doctors, they get opinions and second opinions. Misinformation doesn't exist. This law is unconstitutional. It hasn't gone into effect yet, and it needs to be struck down.
Yeah. You have an excellent point about how when patients go to a doctor, they don't just usually get one opinion. They'll go and get multiple opinions here. But doctor, who is making these laws? Who is deciding how this is going to be dictated?
You know, that hasn't been disclosed at all. The only terms that have been used is that there must be some type of consensus, that doctors must follow a consensus. Consensus they're slow to form. This has been a rapidly evolving pandemic. Still, the information continues to evolve quickly. You know, one of the most clear examples is the virus has become much more mild. So what a doctor tells a patient with respect to prognosis and treatment now is very different than what they said a few years ago.
Yeah, that is the crazy thing to me. And if you have, I mean, who knows? It could be unelected bureaucrats, it could be elected officials making policy that's saying, you know, we are going to go with this, all right? And if you're a doctor and you're like, hold on a sec, I got some new data that says, no, I mean, let's take masks, for example. That was like widely accepted that masks were going to stop the spread of this. And it turns out now that masks have virtually no measurable effect on this pandemic at all. And it had negative effects on our children learning. So how do we evolve in the medical field if we can't ask questions?
You know, that's completely correct. You know, medical care is so complicated with respect to COVID. For instance, we have Evusheld, a long-acting monoclonal antibody that can be used in place of a vaccine. So doctors have to help patients make the choice. We have a whole array of drugs. The CDC recently said that masks really only role in healthcare is when we're directly dealing with COVID. We don't have to wear masks in other situations. This is so rapidly evolving. There is no way that a medical board can actually craft a narrative and try to have doctors follow it and then penalize them if the doctors are not on a specific line. This law is actually now subject of a lawsuit. Two prominent doctors, Dr. Barkey and Dr. Mark McDonald in California, are suing. Other doctors should. It hasn't gone into effect yet, and it should be struck down.
Yeah. Doctor, what is the response from the medical community, and are other doctors saying this is unconstitutional?
They're seen as unconstitutional, but I can tell you doctors are trying to protect their interests. Many doctors say they're going to leave California. This is the last straw, so there's going to be even a greater constraint, particularly on primary care. The other thing doctors are saying is that COVID is simply going to be taken out of their practice. They're not going to deal with COVID at all. Post-COVID vaccine issues, they're simply not going to be dealing with COVID. Patients are going to be left without care.
Yeah, well, this is the problem is like Reagan used to say our well-meaning liberal friends. I don't think they're well-meaning anymore. I think that this is about, like you were saying, control, not actual solutions. But it's at the end of the day, it's we the patients that are getting affected by this because doctors have to sustain a living, obviously. What do you, if you were sitting there on the board of these decisions, what do you tell Gavin Newsom? What do you tell the legislature?
I simply have to tell them that doctors need the complete freedom of their profession, just like lawyers, engineers, and others do, that once the government starts to insert itself into what can be said to patients. We've stepped over a line. It's actually a line of people are very concerned about totalitarianism, this authoritarian type of approach where the government now is influencing, violating human rights through medicine. Doctors and also nurse practitioners and PAs now are becoming instruments of government's overreach and violation of civil rights. Doctors, in a sense, are becoming state actors. There's a state actor doctrine that says when the government tries to use a private entity, that private entity must ensure civil rights. So now doctors are actually caught in the middle.
Yeah, it's crazy. It's like, and Gavin Newsom, that is likely probably the 2024 Democratic nominee. Yikes.
Dr. Peter McCullough, thanks for joining us this morning and for your insight as always.